So as she said, we're going to move on into the compass. So in the inner ring, that light blue ring of the model is the compass meetings. And as Patty said, this is really progress tracking. So this is where we start to give a structure of support for the orientee. And we ask that the facilitator of onboarding, that educator, the A&M, the CNM, whoever that might be responsible for onboarding in your area, could be a CNS, that person along with the preceptor whenever it's necessary, and of course the orientee, are going to have a set meeting of every 2 weeks. And this is where we sort of spell out how that orientee is doing. We're checking in their onboarding pathway to see if they're actually continuing to progress. We're looking to see what KSAs have been acquired. And overall, how is that orientee feeling about what's happened over the past 2 weeks? This is where you would discuss your goals and just give overall support and check in as needed to the orientee, and kind of checking in on that relationship as well between the preceptor and the orientee. And then as we move on, in CHCI, everything is going to be documented electronically. So this is a screenshot of what the Creative Healthcare Insight documentation will look like. And you'll notice on the screen where the arrow is, this meeting is the compass meeting. And so we have set questions in here that were created by the educators at Christian Hospital. So they've been tested and validated that these are really great questions to help. So the facilitator of onboarding will go into the meeting and they'll get these prompts. And like for the example here, the first question is, what type of patients have you cared for in the past 2 weeks? The response would then just be free texted into where it says type your answer here. And then the next question says, well, what knowledge, skills, or abilities have you performed independently over the past 2 weeks? So you would mark that. Overall, there's about 10 questions or so in the compass meeting, but we just want to capture how are they doing? Are there any areas of concern? And that we just kind of keep track of that progress in a quick little cadence of every other week.